Appreciate you all being here for the regularly scheduled meeting of the Board of Directors for Sacramento Metropolitan Fire District for June 27, 2024. We're going to call this meeting to order. With that, I'd like to have our board clerk call the roll.
Yes, Director Sailors.
Present.
Director Weber.
Present.
Director Gould.
Present.
Director Wood.
Present.
Director Rice. I don't see him, he's absent. Director Jones. Here. Director Costa.
Here.
Director Clark.
Present.
And just to make mention that Director Sheets let me know that she will be absent this evening. She had a prior commitment.
Yep.
Thank you.
Thank you very much for that. Appreciate it. Thank you very much. We do have a quorum. Let's begin tonight's meeting with a pledge to the flag. Director Weber, if you'll join our lead us, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Director Weber. Appreciate that. Ladies and gentlemen, those of you that are interested in watching these proceedings at a later date, if you'd please reference the agenda posted for the public relative to all of the information about where that can be found. Okay. With that, let's go ahead and open up the meeting with an opportunity for the public to discuss matters of public interest within the district's jurisdiction, including items on or not on the agenda. Madam Clerk, do we have any speaker cards?
I don't have any speaker cards, but is there anyone in the room wishing to speak tonight under public comment or online? If you're online, please raise your hand.
No online response.
No response. No public comment.
Thank you very much. Appreciate that. Next on the agenda is consent items. I'll see if there are any questions relative to the items on consent or any questions about any of those items. Not seeing any from my colleagues. I'll entertain a motion to approve consent.
I so move. Second.
Second, thirds, we got a whole bunch of them.
I'm sorry, who made that first motion?
I think it's Director Weber. Yeah.
Okay. Weber, Jones, thank you. Director Sailors.
Aye.
Director Weber.
Aye.
Director Gould.
Aye.
Director Wood.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes. The consent calendar is approved.
Thank you very much. Just want to call out item number 5. Once again, our men and women are doing an incredible job of finding those grants. And thank you very much for all the efforts associated with that. Anytime we can be associated with that, it takes a little bit of pressure off of our budget, and that's always a good thing. So, ladies and gentlemen, tonight is basically the culmination of a couple of months of hard work to get us to this point. It is a unique opportunity for the Board of Directors to be educated on some pretty important topics as they relate to this department. And so we will have a bit of a different flow. Tonight, what we're going to do now is we're going to go into basically a brief break. We'll suspend our meeting, and we are going to go next door, and we're going to grab some vittles. That's important to keep Director Weber's blood sugar high, and mine as well. And so we're going to do that, and so we'll suspend the meeting for a minute. We're then going to, if you could allow us to get there, we're going to come back and come to the dais because we want to maintain an open meeting, but we will be having some dinner. I think there are some of you that have been invited to participate in that as well. And that way we can be eating and learning. Please, those of you that are going to be presenting, and we got a whole bunch of folks that I don't recognize, so I'm sure it's going to be quite educational. But if you please don't be offended if while you're speaking to us tonight, we may be taking in some food. If you knew anything about how we normally feed ourselves in closed session, this is much healthier, and so we will be more attentive instead of almost comatose sometimes with sugar highs. So with that in mind, go ahead and suspend this meeting as we go to a presentation item. We're going to take about 15 minutes, if that's okay. So we'll start by my watch at 6:20 or 18:20 for those of you that know what that means. Okay? All right, we stand adjourned.
Recording stopped.
All right, ladies and gentlemen, we're going to come back into open session.
Recording in progress.
And like I said, please excuse us as we watch you and also eat this evening. Before we begin, I just wanted to say thank you to our ad hoc committee on workers' comp. I know that there's been a lot of effort that has gone into this. There's been a lot of conversation. So not only the participants who will be presenting tonight, but Director Weber, you and your team in the ad hoc committee, thank you for getting this organized. We're very interested in continuing this. And I know this is one of many presentations we'll have on a variety of topics. Workers' comp just happens to be that one that we felt was prioritized. And so thank you very much. I'm going to turn it over to, who am I turning it over to? Intercare. Melissa, do you have anything you want to say as an intro? Oh, she's got cards.
I'm nervous. Good evening, directors. I'm Melissa Maddox, the Chief Human Resource Officer for Metro Fire. Tonight we have our entire team from Intercare, so I will let Danielle introduce all of them one by one. Tonight we're here to present the Work Comp 101 that we promised a long time ago when we had first talked about even getting a new TPA. While Danielle will be doing the bulk of the presentation, we are all here in support and here and ready to answer any questions you have. So please don't hesitate to interrupt us. And there's a lot of information that's going to be coming towards you tonight, so it's good that you have burritos and you'll stay awake. So before we get started with the presentation, I just want to talk a little bit about where we've been. So if you recall, last year we went out for RFP, and some of this may be repeat for some of the directors, but I don't know if everyone was there when we gave the award for the RFP. So we had the review committee made up of myself and Candace Sarlis, our work comp coordinator, and Vice President Schollard and Assistant Chief Law. And the purpose of that was to have the SMEs who deal with work comp every day, me and Candace. I should say Candace. And then a line perspective on the RFP process, and then also someone who had been through the work comp process themselves. So we had very unique perspectives coming into the RFP. The goal of the committee at the time, it was to find a TPA who understood the special needs and complexities of Metro Fire and all of our claims. The first one being that we were a special district, which is different than cities and counties that have fire departments in them. And then we needed them to understand that we were going to have a little more direct involvement and input and influence over every claim. And then second being that we were a fire district. We needed the new TPA to keep up with our volume of injuries, the severity, and the complexity of some of our injuries, unfortunately. But most importantly, we needed the TPA to provide our members with first-class customer service, the utmost respect and empathy and humility for our members when they were injured. When we started the process, the committee got together and we were handed a binder with 1,800 pages in it. I think I can speak for the committee that we did not have any spare time to do that during work hours. So there was many nights and weekends that were spent reading this because we were on a strict timeline. But we all understood how critical our recommendation would be, and how much it would affect our members and the future of Metro's work comp program. At the end of the day, we came to an anonymous decision, which I think kind of shocked all of us because we were all coming from different perspectives of the process and the work comp process itself. But we were all kind of looking at each other like, really? Wow, we all agree. It's amazing. So as you know, we brought in Intercare in November of last year. Candace and I were very nervous about the transition, the conversion of converting from the old TPA to the new TPA. We had no idea what that looked like. We had no idea what the workload was going to be. We were scared it wasn't going to work or something was going to break, and we had to go live date, and we've never done this before at Metro Fire. We have always had not necessarily the same TPA, but one TPA is bought out, the next one and the next one. We never actually converted to a whole new TPA. But to our relief, it could not have been easier. Intercare was amazing, and the process was absolutely seamless, just as they had promised. Me and Candace had, Candace had a lot of involvement in it as well, but I was shocked at how smooth it went. And there was a few bumps in the road in the very beginning once we went live, but that was to be expected. And that technically I wouldn't say was on Intercare's part, that was previous issues, so. Since we went live, Intercare has continued to fulfill our commitment to Metro Fire, has continued to fulfill their commitment to Metro Fire, and have been extremely proactive and helpful in getting our program back on track. One huge example of their promise to us was to try and get our best examiner that we used to have on our account, and had unfortunately had left our previous TPA, and she's here tonight, Stephanie Gonzalez. Sorry, Stephanie. Stephanie was on our account for over 7 years. So she had built a lot of relationships and rapport with our employees. They trusted her when she called. And she understands how Metro Fire works and all the intricacies of all of our claims. And her and Candace can probably not even talk and know what each other's thinking. So we were really excited that Intercare jumped right on our request and were able to recruit Stephanie, and now she's back on our account. So we were really excited about that. In addition to the presentation you'll see tonight, HR has made tremendous progress in my mind on improving our program. The new app, which I'm assuming, I think some of you have seen, the new app on the apps page, the Metro apps page that all employees have access to, there's a workers' comp app. And on that app, there's the PDF forms to file a claim and the instructions on how to fill out those forms. There's also the web instructions to file a claim, so you can file your claim online through Intercare's portal now, and there's all the instructions on that. There's also a full contact list of who, what, when, where, and who numbers, emails of anybody you might need to contact if you have a work comp claim. And then there's a flow chart, a work comp process flow chart from beginning to end of the claims process. That an employee could look at and try to follow the process. It's kind of complicated just because the work comp process is complicated, but there is a pretty fairly easy to follow flow chart on there. And then there's also a utilization review question and answer from the Department of Industrial Relations website on there. And we're continuing to add onto that app every day. If new things pop up and we think, oh, that would be great to put on the app, it's helpful information. That would, we're always willing and open to suggestions. We don't want to make it too full because we don't want people to not be able to find what they need when they go there, but so far it's working pretty well. In addition to the app, we have, Director Weber will be very happy, we have a draft work comp program manual. So it is just a draft, so we haven't shared it yet with the ad hoc committee, but we plan on bringing it to the next ad hoc committee so we can critique it. Right now it's sitting at about 40 pages. So our hope is that while we want it to be completely in depth from beginning to end of the work comp process, we also don't want people, we want people to read it. So we don't want it to be too long. So we're hoping we can narrow it down a little bit, but I think it is kind of what we were looking for, of like the complete guide to the work comp process, not just within Metro Fire, but all the other stuff that goes along with it. So we're pretty excited, and I thank Candace for working really hard the last few weeks to get this together for tonight. And then, like I said, we'll bring it to the next ad hoc committee. Moving forward, we want to continue providing our work comp presentations to all of our new hires, and also at all of our promotional academies, so the Engineers Academy, Captains Academy, and BC Academy. Candace will go out and do an hour, presentation on workers' comp. What do you do? What do you do as a supervisor? What are your responsibilities as a supervisor, that kind of thing. And for new employees, it's really basic. What do you do if you get hurt? And then we're also looking forward to hiring our additional work comp coordinator. And we anticipate interviews to be in the next few weeks. I think this additional assistance will really provide an integral piece in us trying to move forward and make our program better and get to that next level that we're all hoping for. So with all that said, lastly, I'd just like to thank the board of directors for giving us this opportunity to present this information and overtaking an entire board meeting. So we do appreciate it. And at any point, if our brains stop and we're done, we're more than willing to come back and do part two. So please just let us know how you'd like that to go.
Melissa, if you could just hang tight for just a second.
Sure.
I think it's important that we also start this educational experience with a clear understanding that by us doing this, in no way are we suggesting that this organization was not doing workers' comp poorly. Okay, so all of you, I do not want any of you to interpret, as we become better educated, we know that you're stepping up your game, you're willing to do this for us, but I need to start the meeting with, we are not calling anybody out because they weren't doing something, or they were doing something wrong or poorly, or we're all growing. This organization has grown over the last 2 decades, right? And this is just one very important area, but one area that we're growing on and doing better. So I want to call out you and your team for being willing to kind of lay it out there and here's what we do. And we're open to being, to changing and those things. Because that's a huge, I know that can be stressful when the politicians say, hey, we need a report, and all of a sudden people get a little bit amped up. But we're happy that you're here. We're happy that you've done all this work. We're very, I think, looking forward to learning more, because this is a big deal and it's only getting bigger for our organization. And so just wanted to make sure your team comes to the presentation and the dais tonight knowing that we're not looking for opportunities to pick apart anybody. It's just we all want to learn together so the organization can continue to grow and deal with this efficiently. Okay?
Thank you. I appreciate that. And we want it to be better too, and think of new innovative ways and just make it better.
Yep. Okay. Thank you.
Thank you. Okay, so next I will let Danielle introduce herself and her entire team, and she will present the presentation.
Okay, thanks, Melissa. Thank you, Melissa, and thank you to the Board of Directors for having us here tonight. My name is Danielle Burry-Beaton, and I'm the Senior Vice President of Client Services at Intercare, your third-party administrator. I'm going to have each of our teams stand up and introduce themselves and kind of tell you their role on the program. We'll have an opportunity for Q&A. We really want this to be as interactive as can be in this environment. So please feel free to ask questions, throw things at us, look at scenarios, because we really want to make sure this is a great opportunity to learn going forward. So let me start with Michelle. Go ahead.
Michelle, if you could come for our massive TV audience.
Okay.
If you could have them come to the dais just so the audio picks it up and you get on camera.
Oh, all right.
So get ready, guys.
Hi, everyone. My name is Michelle Metters, and I am the Client Services Account Manager for Sacramento Fire, and I work with Danielle and Melissa and Candace to make sure they're all the behind the scenes and all the reporting and the stewardship meetings and all the information that they need to do their jobs more effectively.
Great, thank you. Luann?
seems like a long walk all of a sudden, doesn't it?
Well, when your legs are only this long, they are. Hi, everyone. Luann Koppel, Associate Vice President of the Claims Operations in the Rockland office. My role with your group is to work with the claims team, be a second set of eyes, help out wherever I can. I know my voice sounds like a cartoon. This makes it even worse, and I am fully aware. Thanks for having us here.
Thank you for being here.
Heather?
Good evening, everybody. I'm Heather Spivey. I'm the supervisor over the Metro program, and I assist the team with just oversight and getting things going and moving along as they should on the claims.
Thank you.
Our rock star.
Sometimes. Hi, I'm Stephanie Gonzalez. I handle all your work comp claims for injured workers that are losing time from work, all the litigated claims, to make sure we can provide excellent medical care, take care of them while they're off work, and get them back to work as soon as possible. Yeah, that's what I do.
Hello, everybody. I'm Joseph Casto, and I'm the adjuster with Sac Metro, and I handle the medical only and future medical claims. Pretty much, I just manage their medical care and keep them going, and I just follow up with the injured workers. Thank you.
All right, thanks, team. I'm going to move this. I have a louder voice, I think, so I'm going to move that away a little bit. So we're going to go ahead and get started. Okay, I'm like, Arthur, it's not working. Okay, so I will definitely try to breathe in between here so that you can interrupt me and ask questions. The first thing is that this is really the agenda of what we're going to talk about today. And these are things that we came up with together with the ad hoc committee of just things that we thought were important for the board to know going forward. So we're going to look at reporting new injuries. What does that look like for the district? The work comp process and treatment review. Don't worry, there's not a test at the end because it can get kind of convoluted. I know you're sad. The types of claims that can be reported to us, some affirmative defenses and presumptions. We talk a lot about the presumptions for the fire department and the firefighters. Utilization review, which you guys have put together an excellent program to make sure that things are authorized as quickly as possible. And then what it looks like when they are maximum medically improved. You may have heard the term permanent and stationary in the past. That's another term. And then settlement. So those are going to be the things that we're going to cover today. So what is workers' compensation? We all know really what it is. It's a system set up to handle work-related injuries. Before this system was in place, employees could sue their employer. That's how it was handled. So pain and suffering, all those kind of things that happen with lawsuits could happen for any injury. So this was sort of a compromise that was made many, many years ago to cover workers' compensation for employees and under their employer. Reporting new injuries. So, Melissa did a great job talking about, and thank you for the kudos, Melissa, too. That was really nice. And we are just so thrilled that it was a unanimous decision. It just still kind of brings a little tear. So appreciate that. But the HR department has done a lot working with us and working with each of the firehouses on reporting new injuries. And what does that look like? Melissa talked about the app. Candace is very involved in that initial process. They can go on our website and report a new case themselves. Injured employees themselves can do that. It goes right to the HR department for them to look at. It then comes to Intercare and we set up the case. Hard copy forms, other things then start that conversation between HR and the employee, and between Intercare and the employee, and Intercare and the HR department. So all of these things are happening simultaneously as we're notified of a new injury.
We have the web address on there that to report new cases. It's also on that app. I believe that everyone has access to. Okay, so for your reading enjoyment, when an incident occurs, so that's okay, something's happened. We all know if something is very serious, catastrophic, not everything follows this process in line because sometimes it is all hands on deck, nurses at the hospital, coordination is being made with the family, with the injured employee. But generally, if think about a general case, really an incident happens and it's a determination of do they need medical treatment or not. Sometimes it's an incident that they don't feel they really hurt themselves, but they don't know. Let's see how it is tomorrow. So if they need medical attention, it really follows that left-hand side of this page where you can see what they do. And really it's about reporting the injury and getting them to the doctor as soon as possible. And of course, depending on the type of injury, depending on what kind of medical provider we're trying to get them into as soon as possible. If they don't need treatment, then we just sort of keep track that an incident happened so that if they do need treatment at a later date, that's all documented. The next section is looking at, okay, the incident happened, they needed treatment, and then what do we do? So really that goes directly to Heather, who is the supervisor, and she reviews the claim initially and makes some recommendations to the adjuster. So she's assigning it to whether it's Stephanie or Joseph that you met and kind of helping them with, okay, this came in, let's watch out for this, let's make sure we're doing this, that kind of thing. As soon as Stephanie and Joseph get that new loss, then they're calling the injured worker. They're calling the HR department and having coordination of what needs to happen. Again, you have cases that are very minor and cases that are very serious. So it's sort of the gamut of what needs to happen and at what intervals. The adjuster is also calling the medical provider. Usually at that time they have been seen or have an appointment to be seen, and so they're working on, what kind of treatment is going to be appropriate. For this program, there has been put in place authorization so that the medical facilities can go ahead with certain treatment modalities without even requesting authorization. You also have where our adjusters can authorize a lot of different treatment modalities without having to go to full utilization review for a nurse. So these things can be authorized and happening right away, which is really important for the members of the district. Any questions so far? Oh, guys, geez.
How often is that list reviewed and by whom?
The list is reviewed between Intercare and the HR department. We've been on the program since November 1st. I think we've made adjustments already, probably about 4-ish times, adding things that, with utilization review, things are going to be automatically denied. And I'll give you an example. You hear a lot about these PRP injections. And it's a sort of almost think of it like a blood transfusion, and it's very innovative. But utilization review, when it comes to medical providers, their peer review, they're not going to authorize it because it's not under certain guidelines that are accepted for certain injuries for workers' comp. So we have just, those are just authorized. Any of the injections that need to take place. We don't want to hold that up. They're not expensive in the scheme of things, and so we don't want to hold that up. We want to make sure those are authorized. So we look at it anytime we need to, basically. If we have a situation where maybe we need to think about adding this. Maybe there's a new treatment out there that we didn't anticipate 6 months ago that's now the big topic or the big thing that doctors are requesting. So we'll look at it anytime. Yes.
I'm interested in my own healthcare, so I go out and I find some Amazon jungle treatment thing, and it looks like it's got some decent research. How do I then make HR or Intercare aware of the fact that I found something that benefits me because of my injury, and at least bring it to your attention so that it could be looked at for legitimacy on getting into that list that you all review?
Yeah, you could make that recommendation to HR. That's probably the best place to start. And then they would then vet it and work with us to vet that. Intercare, we have our own in-house nurses and medical provider director. and that medical director helps us with some of these more innovative type of things that come out. And sometimes, you may not authorize those always. You may not put that at the adjuster level right away, but you want to see what kind of success rate it has and how it's utilized. At the end of the day, we want the members to receive the best treatment possible, but we also want to protect them and be safe and ensure that they're not receiving things that are not appropriate. Someone can only have so many injections, for instance, and it can be harmful. Someone can only be on certain medication for so long, and it can start being harmful and cause other problems. So we're always looking out for that piece as well. Yep.
I think it's open, guys.
It's open.
Please don't, you don't need to go through me. Let's have it open and interact.
So to build off that, how long is that process?
The process for, like, if you found some kind of treatment that you've heard about, you read about, you want to, I would just go to HR, and then they would just talk to us right away. We would get our medical director involved right away and kind of look at it. Sometimes we'll then come back with, okay, yes, you read this, and this has this information, but here's these other, articles that have actually been written and printed on, because these days with social media, things can be out there that aren't necessarily true. Everything on the internet is not true. So we have to really make sure to vet that and look at it. But if it's reasonable and it's showing that it's working, again, we have our medical director look at it just because we want to make sure we're not doing something that, could potentially cause harm. But it's very quick. It's, we're here for you. So as soon as HR brings us something, we're looking at it and going through it as quickly as possible. Yeah, it's not a long, drawn-out process. It could be 48 hours to 30 days, depending on what we're talking about, like how big of a, yeah. You're welcome.
So to your point, I just reviewed it not too long ago, and I saw that hernias were not on there.
Right.
I emailed Melissa, and how long did that take to get approved?
Yeah.
So 1 day.
I'd just like to clear one thing up for educational purposes for the room. Again, back to what is work comp. 100% correct. The system was set up, I mean, you know this, I'm just saying this for the folks that don't. It was set up so the employee cannot sue the employer. The offset of that, for the employee giving up the rights to sue, then the employer then agrees to take care of the employee. It is not a money-saving component for either the TPA or the district to save money on it. It is a component to take care of our people. And that is the rest of the conversation, what is work comp? Just want to make sure.
Yeah, that's a really good point. And really, it's the sole remedy. So if someone is injured at work, their remedy is to file a workers' comp case and go through that process. And of course, we're always looking at ways to improve that process. It can be convoluted. California can be difficult in certain circumstances, but we're really trying to make sure that that employee is taken care of. At the end of the day, that's what we're all trying to do. But we have legal and other things that we have to take into consideration as well. So on this next page, they get treatment. We're always looking at those initial cases, whether we can accept the case right away. It's work-related, no issue, we're accepting the case. That's like 99% of the claims, this is what happens. Sometimes we have to delay a case because we don't have the information that supports accepting that claim right away. We may need a medical legal evaluation. We may need more information from the treating provider. We may need more information from the injured employee that we can get just in a couple days. There's certain things that can require that. Some of your more difficult claims, some of our cancer patients, some of the cardiac, some things that can be caused by work but can sometimes have other factors, may take more days to try to really evaluate and make sure that it's workers' comp. And then sometimes you have a situation, this is very rare, but it can happen, where someone says they were injured at work and the doctor evaluates them and it's, right away that happened on like day 2 and it's determined to not be work-related. This is actually a something that is absolutely not work-related. And so those cases are denied right away. That is very rare that that happens, but those are the three kind of paths we're looking at initially. 99% of the cases are accepted, and those that need to have more time to make that decision are then delayed to allow that time. With workers' comp, though, while that case is delayed, we're still paying for medical treatment. We pay up to $10,000. Many times the district has decided to pay more depending on why there's a delay. Are we waiting for something specifically from a medical provider or whatnot? Because none of us want to be in that position where we're having a member, an employee that's injured, having to wait. That takes a long time. It can, and so we're trying to do that as soon as possible.
The 99%, thank you, is within that 14-day window?
Yeah.
Okay, thank you.
Okay, so as an adjuster is handling their case, they're managing their case, they have a caseload, they're managing those cases. We're kind of starting from when a new case comes in, but they're looking at, is the injured employee able to go back to work? Are they off work completely? Are they on modified duty, have some kind of restriction? Or are they back to full duty? What is the situation? And then we're looking at what treatment they need. The district has it set up so that we're getting diagnostics and all of those things right away. We're not waiting for conservative treatment to take place to then get that. Because if someone, obviously with a fracture, an x-ray is gonna show that. Most of the time it's way more convoluted than that, and you need a MRI or a CT scan to make a determination of what's necessary. So we're authorizing those things right away and trying to get them in for that diagnostic so then a decision can be made. We can get them into the right medical provider, the right surgeon, orthopedist, neurologist. Where are we going with this and what needs to happen? So we're trying to make those decisions as quickly as possible and getting them that treatment as quickly as possible. Unfortunately, we don't work at the medical provider's office, and we are, under what kind of time frame they have to see patients. So as we all know with COVID, that sometimes changed a little bit in that they're short on staff, they are trying to get people in as quickly as possible, and it sometimes has taken longer to get people in for treatment, especially for surgeries. With the modified duty, if they're released to modified duty, we're always working with HR, and they're working with the different leadership folks to determine if there's modified duty available. So if someone's not able to do their full duty, but maybe there's some other position they can do for a short time, it's meant to be more interim until they can get back to that full duty capacity. The goal is to get everybody back to where they were before they were injured. But as we know, some injuries, that's just not going to be the reality, but we want to try to do everything we can to get them the treatment they need to be able to make that happen. The types of claims, so you have an incident that may have happened, but they didn't get injured. They fell, but they just laughed, because that's what we all do when we fall, and then we decide if we're injured later and we see what's going on, because we're embarrassed, right? That's what I do, at least. So, an incident happened, they fell, but they may not have been injured. So that's something that we just take a record of if it gets reported to us. So we all know if they do come back later, if, a week later my back's still hurting, I may now file that claim, that kind of thing. You have a first aid case, which is just one minor treatment and maybe one follow-up. Stitches is a good example. They don't need prescriptions, they don't need PT, they don't need an x-ray. One minor treatment and one follow-up. Heck, sometimes they're taking the stitches out themselves and they're not going back for the follow-up. So those are the first aid type treatment that we see, type of cases. You have your go ahead.
I was just gonna say, on those cases, these reports never sunset, correct?
Correct.
There's no 7 years from now, we're purging our records because of the nature of our business. These things are reported and they stay into perpetuity.
They stay in our records, but they don't necessarily can't come back 7 years later and say, okay, when I fell back 7 years ago, I now have issues. If they still worked for the district, probably what's more likely is 7 years ago they fell, they continue to do whatever they do for their regular work, and now maybe they're filing a new injury or they're filing a cumulative trauma, which happens over time. You guys do have several of those where someone didn't just do one thing that injured themselves. It's pulling the hose, whatever it is, it's over time, and now their back is like
By
damaged.
notifying you and having
We
this
have a
there,
record.
you have a record, so if
Right.
10 years from now, I want to reference as an employee.
Yes.
Reference back to an incident I had in 1958, you would have that record.
Yes, yes, as long as it was reported to us, we have a record of that. It doesn't go away. It's all electronic now, but it does not go away. It's always in our system. Okay. The other thing is medical onlys. So they're continuing to get treatment, but they're not losing time from work. So that's usually your more minor injuries, and they are treating, maybe going every 30 days, maybe getting PT, maybe not, but it's a more minor in nature, and usually those close within just 6 months. Those are closed. The first section of those are not the cases we all talk about. The ones we talk about are the ones where they're losing time from work, they're frustrated, they might be getting treatment, they might be having to wait for decisions, they may have permanent impairment, permanent disability, there may need to be a settlement of their case at some point. Of course, sadly, any injuries causing fatality, any of those more serious injuries, those all fall under the indemnity section of those types of cases. When Stephanie came up and talked about the cases that she handles, those are the cases that she handles, those indemnity cases, the more significant, more severe cases.
The 1%.
Yeah. Maybe a little more than 1%, but they're the.
Wait a minute. Change now.
It's on recording, right?
Right, on TV.
Okay, so types of injuries. So we kind of just alluded to this. You have specific injuries. Someone falls, that's a specific injury. You have cumulative injuries that happen over time. You do have, like any of our municipalities, but specific for what your firefighters do, this happens, where it's not just from one thing that happened. It's over time that this happens. So that's cumulative trauma. You have an aggravation. So sometimes someone may already have an injury, and now they have a new injury. Is that a new injury? Is it an aggravation of the old injury, or is it an exacerbation of the old injury? So we're always kind of looking at that when they have more than one injury. And of course, this is a great place to work. You have long-term employees. So they're going to have a lot of times more than one injury. And so we're looking at that when they get injured again, whether it is in fact a new injury or part of their old injury.
Can you add mental health to bullets 2 and 3?
Yes, absolutely.
I think if we're doing this in public, we need to recognize the fact that cumulative trauma from a mental health standpoint is growing and will probably be a very significant issue for this department. And then obviously we have cases and calls that we go on that aggravate our
Right.
mental health issues. And so I just, as a public record and as a public presentation, I'd love to see that added.
Absolutely.
So we're recognizing that that's a real deal and we need to take it more seriously in
Very
the
seriously,
future.
yeah. Yep, absolutely agree.
Thank you.
We can certainly do that. Okay, the benefit types. I think, a lot of you probably already know what kind of benefits the injured employee receives, but I'll just try to go through, the bullet point here. So you've got the medical treatment, pretty straightforward. We all understand that. All the medical treatment that they need, prescriptions, physical therapy, diagnostics, any medical treatment, any medical providers, any specialists, all of that falls under medical treatment, okay? And any of your injured employees that are either a medical only or an indemnity, they're getting some form of medical treatment. You have temporary disability, which also includes 4850 salary continuation. So those benefits are kind of part of the indemnity benefits, temporary disability kind of umbrella. You also have permanent disability, when someone is determined to have permanent disability, that they're now disabled to a point where they're going to have some level of permanent disability. You can have minor permanent disability, let's say 3% permanent disability, and still do your full job. So it just depends on what the doctor outlines and what they've indicated. You have some level of permanent disability. And that's where we get into settlement and other discussions about resolving that claim when it comes to the permanent disability. You also have supplemental job displacement voucher. This is, years ago we had what's called VOC rehab, and we would actually pay to re-educate people, to go to a rehab counselor, to go to school even, to be able to go into the labor market in some kind of form that is different now with their restrictions. That is no longer available, but what is available is a supplemental job displacement voucher. So if someone is permanently disabled, not able to go back to their job, but they want to go and have training or go to school, they can do that, and they can get a voucher under workers' comp to help pay for that. It certainly doesn't pay usually for the whole thing, but it's something, and it's to replace that vocational rehabilitation benefit. And then you have death benefits if anyone passes away due to their job. Then there are death benefits available to their family, their dependents, and there's a variation of that benefit based on how many dependents they have and at what age those dependents are. So it's very statute-driven with the labor code to determine what amount of benefit they can receive. If you have someone with 6 children that are under 18, you're looking at a very long benefit payout, usually depending on working with the district of, do we want to try to give them some kind of lump sum amount that they can then control that money going forward. There's just different ways of that benefit that gets paid out. Affirmative defenses. So one of the things, Bob, that was a really great point that you brought up about workers' compensation being, there as a benefit to the injured employees. There's a few things in workers' comp. Most things in workers' comp are really at the injured employees' benefit of the doubt, let's say. There are certain things that they're called affirmative defenses, but even so, it's still a gray area because you can still have one of these things happen and have them still be covered under workers' comp. So these are things that the labor code says, if one of these things happen, then it's not work-related. So, I'll just use an example of intoxication. So just because someone is intoxicated at work, we all may think, well, they shouldn't get workers' comp. They were intoxicated. But let's say they were intoxicated, but they weren't doing anything wrong and someone ran them over in the parking lot. It wasn't anything that was their fault. Well, that's still going to be covered under workers' comp. So you have to take it all, both sides, with a grain of salt, because there's many gray areas in workers' comp. Every case is on its own merit. Another example would be initial aggressor. So really, I hope this doesn't happen, but if you had, 2 people at the firehouse and they got into it for some reason, the one that started it would be considered the initial physical aggressor, and even if they then got it worse, on the flip side, they probably wouldn't be covered under workers' comp. So, that's, again, gray areas, because there always is in workers' comp, but those are things that are covered under the labor code. I know you're all thinking about incidents now. Yes. Yes, going and coming for a lot of your firefighters is covered, but going and coming technically would be the drive from your home, let's say from my position, the drive from my home to work. And to work is usually the parking lot if it's provided for your employment. A lot of that is not necessarily the case for you guys depending on their position and what they're doing, but that is technically what the going and coming rule is. Okay, so presumptions. Presumptions are in place that are really presumed outside of other information to be a work-related injury, okay? That said, like I said, on all sides, there's gray areas and every case is on its own merit. So the burden of proof with presumptions, and this is outlined in the labor code, which is what we all go by, and no, we don't have it memorized, and it's like a book like this, but it's pulled out a lot to go through because we're trying to make sure we make the right, best decisions we can. And it's how we learn when we're learning how to handle cases. So a normal case, the industrial injury, the employee has the burden of proof to show that the injury or the disability arose out of their employment. To be work-related, it has to arise out of your employment and happen in the course of your employment. So both of those things happen. And we refer to it as AOE, COE. If you've ever heard that, if you ever attend a claim review, you may have heard that. So arise out of employment and in the course of employment. When it comes to the presumptions, the employee must meet this burden of proof normally when the preponderance of evidence. So we're always looking at, okay, what does the employee meet in terms of whether it's presumed or whether it's not presumed? And it has to be the convincing force. So of course, we take each case on its merit. This is in the back of our mind. We know there's presumptions. We know how important those are and why they're in place, and the years of hard work fought to make sure that those are in place to protect those positions, firefighters, police officers. So what is the presumption? So we've kind of outlined it here, simply put, as unsimply as you can put it. It's an assumption of fact the law requires to be made from another fact or group of facts formed in the case. So it's under this evidence code. It's statutory, so it is, in the labor code it is required. And its enacted facts can either be conclusive, meaning there's no dispute to them, or rebuttable, which means that it is presumed, but it may be rebuttable for a variety of reasons based on all the other factors that we all come with our human body and all the things that happen with us. So although there are presumptions, we still have to look at each case and what each injury is to make sure that it truly is work-related. We're trying to do that as fast as we can, but you can imagine with certain things, and I will say cardiac and cancer are two very difficult ones because a lot needs to happen in terms of medical information to make those determinations. Any questions on just this piece? Because I know it's a lot.
Yes. So we have presumptives, heart, lung, on and on
Right.
and on.
Hernia.
So you're saying that there's still, or there could be, burden of proof on the employee that he or she has been here for 15 years and now he or she has cancer. You're saying that the presumptive laws don't really apply to presumptive?
They do apply, for sure, but it's a matter of whether they're rebuttable or not for that specific individual, for that specific alleged injury. And that is where we get into where a case might be delayed because we need to get the medical information to then say, yes, accepted. And most of the time, and Candace and Melissa can talk about this, most of the time those are accepted, but we have to go through a certain process to make sure we have the medical information to make that determination. So it's a frustrating one, and it is for us too, because we'd love to nothing more than just to go, oh, it's presumed and it's, everything is taken care of and let's get going on it. But we also have to make sure that we're following the guidelines to make sure that it is truly a work-related injury and meets the presumption without the rebuttable piece of it. So it gets very legalese. It gets really into the legal.
Is there an average timeline on those types of cases?
So when we delay a case, depending on the type of injury and depending on the statute that was in place, you have 75 to 90 days. However, the medical community doesn't always abide by that in terms of trying to get a med legal, which is what is needed a lot of times for those more severe injuries. And so we sometimes may have to do what we call a provisional denial until we receive the report. And then truly, most times, once we receive that report, it's accepted. In the meantime, the injured employee is already treating and getting all the treatment because That's a really important piece to know because they're already getting the treatment. It's just that technically, and they're getting paid most of the time from the district already. But technically, we haven't been able to put that stamp on it to truly accept that case yet until we get the medical information. And that can be really frustrating. And that's where we really try to talk to the injured employee, explain it. Candace and Melissa, let's explain it, talk about it, and kind of go through what to expect, when to expect it. Really, that's where that really important communication comes into play. You guys had a question?
Yeah, quickly, to Director Weber's point, it's fair to say that in a presumption, the burden of proof isn't shifted back to the employee to prove he doesn't have that exempt or that rebuttable presumption. If we are going to
Right.
rebut the presumption, the burden's on us.
The burden is on us, yes, exactly. So the burden is on us, but at the end of the day, the employee is the one that's waiting for, this to happen. So they don't have to go do the legwork to prove that it's work-related, no. So I apologize if I misstated that. It's the burden of proof is on us, and again, in most cases, it is compensable. It's just getting to that point where we can make that decision.
And you said that you had 75 to 90 days to gather that in order to make the decision. I just hate this word in this process of provisional denial.
I know.
I think that comes with such a heavy emotional burden to our men and women that I wish we could get around whatever that legal requirement is, but not be sending something to a member, to use Bob's 15-year member, and say, well, this catastrophic injury is provisionally denied.
Right.
There's nothing positive that comes from that
No.
in my mind. So are you telling me that that's something that you're legally required to do at the, let's say, day 89, you still don't have the stuff. You have to be able to show a future court or something that you notified the employee that you have denied their claim?
Yes.
What a bunch of crap.
Talk to your
Right?
legislators.
Yes.
Right, exactly.
And
because that
it's
is such a terrible message.
It is. So we have to make a decision by that date. And the decision has to be notified to the employee in writing. And that writing has to be the Division of Workers' Comp specific letter and language that has to be on there that we cannot even change, which is why it's so important. And one of the decisions to come to Intercare is communication. We have to call the injured worker. We have to let them know what's happening, why it's happening, not to worry. This is what we're doing. This is what we're going to receive. We're not just going to send some letter out. And we're not just doing that. Candace and Melissa's team, they're also doing that, making sure they understand along the way. That piece is critical. You cannot just send one of these letters out. And we're required to do that if we don't have the evidence and the information yet, which takes some time with med legals to get that, to be able to provide that. We are required to do that. Cynthia.
They did mention that they're getting paid for this 90 days, and at the end of 90 days, they've been provisionally denied. How and why are they getting paid?
So most of them are getting paid by you guys can probably stand, but they're getting paid by the district.
Are they on 4850?
Yes.
At that point, they would not be on 4850, so most employees we tell them to enter their sick leave, and then as soon as the claim gets accepted, then we go back and convert their sick leave to 4850.
So they have 3 months of sick leave?
A lot of employees do, you'd be surprised, but there's other options for employees. That's why we encourage everyone to participate in the donated leave program that I think.
What if they run out of sick leave in 1 month? How do they get paid then?
Well, that's what I'm saying. I'm hoping that they'll be in the donated leave program is what usually will happen.
And keep in mind, you guys, this is not the norm. So this is not the norm that happens. These are those one-off circumstances that happen. And I know we would love it to happen 0, but it is not something that happens every day. It's not the norm of the cases. And it's really important that we're communicating with them and that they have the ability to talk to us about what kind of needs they have too.
And I'm going to follow up on Cindy's issue. And Melissa, again, I'm glad that we have this this idea that out there the good folks of the organization will put into a bucket of money, I don't think that's a safe place to go. I think this organization should be the loaner, the bank, as it were, in these very small, let's say less than 1%, where we get an employee who gets to a point where all of a sudden that 90 days is going to hit and they're going to have to go out and hope for the benevolence of their colleagues and all that. I think this organization ought to be way far ahead of that to say, we're putting in our budget a bucket of money into perpetuity if it's legal, right?
That's your trick.
Right,
There are
is
tax, legal problems.
right, but then to me, it's like, what are we doing to our employee who gets to that 90 days and go, well, we sure hope you can find some money, and it's like, well, we gotcha. You'll have to pay it back once it's accepted or however that works, but we're the bank, not some benevolent group of employees that put money in a bucket. Because to me, I know it's only a very small percentage, but I wouldn't want to be going to my wife going, hey, tomorrow, that's all stopping.
Can I remind the directors to please speak into their microphones so that we can hear you on tape and the whole thing?
Okay. So I know it's been a long time ago, but when I was working as a firefighter, I had two types of insurance I bought, short-term and long-term. So do you guys not have that here at Metro Fire? And one of them I know I had to buy through the union.
Right now, we still offer, or the union offers the long-term, and so does the district. We don't have short-term short-term disability, just because the district doesn't participate in state disability. But I can promise you that to my knowledge, we haven't had any employees go unpaid right out of the gate. Most new employees recognize the fact that they don't have very many accruals, and they go into the donated leave bank, which is all donated by employees, goes into the bank. We have thousands of hours in there, and it has worked. So nobody has went unpaid. No one's sitting at home with no pay. That, I can promise you, that has not happened.
Good.
Now, if someone's out on workers' comp for a very long time and they've exhausted all of their avenues, that is very rare. Very rare. And I could even get you the data to show you that. So and that's what me and Candace do. We will try to work with the employees to say, okay, here's this option, here's that option. We encourage them every new employee orientation to say, you know what, think about this. If you get hurt, it may not be accepted right away. It may not be. You just never know. And it hasn't, thank God, we've been able to work through every single case on a case-by-case basis, and nobody is sitting at home not getting paid. I can say that under
What about
recording, so.
employees that get hurt off the job?
That is also good for donated leave. And the district offers light duty or modified duty for anybody who's willing to accept it. We have people all over the district sometimes, working here, working there, and we also have the 56-hour light duty, modified duty program now too, so it doesn't disrupt their normal schedule. They can still stay on their shift and go be on light duty or modified duty at a station, and they still can do their normal stuff on their 4 days, because we understand that everyone builds their schedule on their spouse's work schedule, and you got your flow, and then all of a sudden you're working for 5 days a week. It doesn't work for everybody. So we're always looking at new options to avoid the situation that you're describing. So that wouldn't be a fun phone call for sure.
So can I ask a follow-up to that then? Is that information that could be provided to the board? You just stated it, but is there a way to get all that?
The light duty policy is
Just
an
all the-
existing
yeah.
policy, and then one of the policies that are going to be coming to policy committee really soon is the 56-hour. The 56-hour light duty policy used to be somewhat of a pilot program that was started when Chief Harms was here. Chief House has now agreed to make it a permanent policy, so we are literally a week away from the final draft. So
Perfect. So we will be seeing those at some point.
absolutely.
And then just to follow up, so if we find that an employee is getting to a point where they're running out of sick time, is that then communicated to the chief? I know it
Yes.
wouldn't come to the board, but you would be
Yes.
notified and you'd be aware. Okay.
Correct.
So there is
And we
something in
discussed
place
that.
to address it.
And we discussed that at executive staff, yes. Melissa
Okay.
brings that to executive staff. We have a conversation to find options. And to our point, we don't have any employees that are not getting paid because of this.
Right.
I think the other policy or procedure you're asking for that we can provide for the board is the donated leave, how that
Yeah, it'd be
is.
good to know, right? Okay.
Yep.
Thank you.
No
Thank you, Chief.
Thanks, Melissa.
Okay, so the last thing on this page, and I know you guys have it in front of you, is why do we have the presumptions? I think, we generally know why we have them. It's really to help with certain public employees who provide vital and hazardous services. So by easing that burden of proof, so again, we talk about that burden of proof, trying to ease that burden of proof from them for those hazardous services.
That's driven by state law.
State law and labor code and statutes.
And does your organization also have historical presumptive claim data so that you don't necessarily have to go through every case, even though they're unique and all that? Do you have a growing body of data that says, here is something that's, to use your number, 99% similar? Because we've got this data in our own organization, we can reduce the time that it takes to make a decision. Is the institution, your institution, learning from similar events in a similar industry and similar injuries so that your adjuster folks can look at this and go, geez, this is virtually the same thing, boom, and we move on, versus narrowing it down to you're spending an extra 3 weeks on a 1% differential. Does that make sense?
Yes, it does make sense. It's a little more convoluted than that because every person and human body is different, and it's just not an exact science, unfortunately. But what we do keep that data. But really, when it comes to making a decision, so much is about the knowledge of the individuals here. And they're looking at that case, they're talking to Melissa and Candace, and they're kind of collaborating on where we need to go with this case. What information do we still need? Do we have enough to make a decision now? And it's based too on our knowledge. So you've got Stephanie, who's been an adjuster for many years and been an adjuster for Sacramento Fire District for many years. So she has that institutional knowledge to be able to work with Candace and Melissa and try to make those decisions as quickly as possible.
Right, and as brilliant as these people are,
Yeah.
I think you and I can both see that AI is gonna make a change in this area as
It
well.
could very well,
Because I think
yeah.
you're gonna see where that is gonna be looked at and very quickly go, well, based on 10,000 of these exact same injuries, and it's gonna be able to help the adjuster feel safe that they're making a decision quicker because it's based on 50,000 cases. And so do you see that coming into your industry anytime soon?
AI is a lot of the discussion that goes on in our industry right now. It's not there yet, but there's a lot of information and testing and things going on already. There's things used for AI, like evaluating medical reports and using AI to skim through and kind of pick up on things. It's not 100% accurate, so it hasn't taken away from having to do it, but we all know it's just gonna keep getting more and more, maybe scarier and scarier, but more and more available. Knowledge is power. We have the data. I do see this in the future as being something that's definitely
And I would hope
utilized.
Intercare is being a leader in that area, because obviously when we start talking about time and what we just heard a while ago, getting our men and women back onto the ground, I think we've got to be open to these scary things that really take a look at this and can do it in a much faster, much more accurate way, because they have access to not just Intercare's 10,000
Right.
similar events, but 1 million of those, and so the error rate drops significantly.
Right.
So I hope you guys are looking at that and saying, how can we help Metro Fire by utilizing some of this technology? Obviously, once it's proven to not be full of errors.
Right.
I hear you
It's gonna
talking
get
about
there.
timelines,
Yeah.
and AI is really well known for trying to truncate some of
Right.
that, because you don't have to spend a great deal of time researching.
Absolutely. It's gonna be pretty exciting,
That's
but
a way better word than
okay.
scary.
Pretty exciting to see what it does. I think the scary part for us is just we all think about what is it going to take over? What is it going to do? But pretty exciting at the same time. We're just not there yet. Intercare has a lot of resources, a lot of internal departments, and a very innovative claim system that has also AI capabilities. So it's coming, it's in the works, it's just not quite there yet.
While we're still on presumptives, the board intrigued me to think about a different question. As we're trying to see what better looks like, presumptives, kind of a misleading word, it sounds like, from the legalese, right? So I'm allowed to inform you, the TPA, that hernias, because they're presumptive, don't need to go through the process. Why
For
can't,
utilization review, right.
why can't we do that with cancer, for example?
So the difference is with cancer, when you say don't need to go through the process, what you guys have changed is that it doesn't need to go through utilization review. But that's already an accepted claim. It's just not going through utilization review, so it's being authorized. The surgery is being authorized. When it comes to cancer, it's a lot more convoluted. And it doesn't mean that decisions can't be made, but at the end of the day, we all want to try to make the right, best decision for everyone, for the members specifically, but for the district as well. So that's why when you get to some of those more really complex, catastrophic, really difficult diagnoses, we're looking at a lot different things. Where did the cancer originate? What kind of cancer is it? How long did the person work for the district? Was it 1 day? Was it a year plus? What kind of job did they do? Sometimes people aren't in the kind of position that they may have gotten the cancer from work. And I'm not saying they did or they didn't, I'm just giving out scenarios. So when it comes to cancer, it's a little more convoluted, a little more difficult, even more so than cardiac and heart. It's not an exact science.
Are there any agencies you're aware of that have pre-authorization for cancer or cardiac in the state of California?
No, I'm not. And we do handle a lot of municipalities with fire and police across California. Yeah, no, I'm not. I do say that, the key is just trying to get the process as quickly as possible and communicate often so that everyone's on the same page. There's no surprises. Pay for the treatment anyway, because most of the time they're treating with their own medical provider. They're treating out of work comp. They're treating with specialists that they need to be treating with, not with a workers' comp doctor that doesn't specialize in oncology. So that all needs to happen anyway. But it's not a perfect system, and it doesn't mean there isn't room for improvement, certainly.
So I've got a question.
Thank you.
Expanding on your statement. So if we have a presumptive and a primary care or a specialist doc has said that it is work-related, the chief has the power to override everything else, the QMEs, everything else, going on the initial doctor's statement that it is work-related. Am I correct in that?
If we have a doctor that says it's for sure work-related, we don't even need to go that route because the doctor's saying it's work-related. That's what we're going on.
Not Intercare. I'm saying if I go to my doc and my doc says, yes, you have cancer, yes, it's work-related, does he or does he not have the authority to override the rest of the process and go, okay, that we're accepting this case?
Correct. No. Because you're not self-administered. So, we're getting into some really gray areas here, but
I know.
if the doctor says that it's work-related and we have something from the doctor saying it is work-related and they are a medically certified doctor for what they're, if we have that information, we're accepting that case. The times that a case is delayed and we're looking into it, presumption or not, is because we don't have that evidence to show that it is work-related. A lot of times even their personal oncologist they don't know whether it's work-related, depending on what it is, what the diagnosis is. So that's when you're getting a medical legal involved and you're having to go down different routes to ensure that you have the correct medical evidence to support the decision of accepting that case.
Does the chief have the power to tell Intercare, we are accepting this case, period?
Yeah.
Okay. I understand everything else that
Yeah.
goes with it.
I mean,
get that.
just to give you a
wanted make
simple
sure that
answer, yes.
That point was making, gift of funds, all of that, yes, I understand all of that. I wanted to make that point.
Yeah. And we've talked about that as well. But yes, the chief can, the district can make that determination. Whether that's the board, whether that's the board directing that the chief can, whether the chief is directing that HR and risk can. You have to keep in mind, it's not a problem till it's a problem, and the chief has now said, yes, this is accepted, and it's a $10 million claim, and your excess is saying, no, we're not gonna cover it. That wasn't work-related, you shouldn't have accepted that. So when I say yes, it comes with risk, and you have to consider that risk. And that's unfortunate, but that is, the reality of dealing with the public funds.
Can I say something?
Yes, absolutely, come on.
Sorry, keep quiet back there. So this came up when we brought the board resolution to you when Chief Haverty was here on the UR. And what we got from Lavra was that the board makes that decision, but they would need a resolution that would allow the fire chief to make that recommendation as the governing board. So I would say as of today, the fire chief legally doesn't have that based on the information we got from Lavra. However, the board collectively could ultimately come up with and vote and approve that resolution if so be.
So the chief has the power after we give it to him. Yeah. And because we represent the public, that provides us a lot more latitude to do that. And I don't know if that policy includes what evidence the board must collect.
Yes.
It does.
Does anyone
Yes.
remember?
Yes.
If
It does.
that policy requires this board to have X, Y, and Z criteria in order to give that direction?
Yes.
Cindy, you're saying it does?
Yeah, we have to see the medical evidence.
So we see it, make a decision, tell
And
the
then,
chief what to do.
as a legislative body, we make a decision
Okay.
which gives him the power.
And the agency and all of us protection.
Yes.
Right, okay,
Yes.
all right.
Now, I had a question, if I can go back to, do our members have a right to sign a form and allow their personal doctor to be their
Primary treating physician or-
their physician of choice when they get injured at work?
Yes, that is, they're pre-designating their personal physician. It has to be, the laws have changed over time, but it has to be someone that they already treat with, and you have to name the specific physician. So like, I'm a Kaiser member, I can't just say Kaiser, something like that. So it has to be their personal physician, and they can pre-designate before they're injured.
So like their primary care provider?
Yes, and that's part of what HR goes over with new hires as well, is one of the things is the pre-designation, if they want to pre-designate a physician.
So if they get injured at work, and then the next day they go see their primary care provider at Kaiser, and that doctor says that is an on-the-job injury,
Yes.
then that is an on-the-job injury.
Yes, okay, medically, yes. And if we're talking, some of the heavier things that we've been talking about, medically, the doctor's making that determination. What the doctor can't determine is something that is cause in terms of things that are outside of medical. Let me just try to rack my brain here. That someone technically wasn't working that day, or, it doesn't fall under a medical determination. It falls under something else. They said they were injured on Friday the 14th, and they actually didn't work that day and didn't work that week. And the doctor said that it was work-related for that date of injury, but they actually weren't working that day. So that's something different. That's a factual determination, but medically, yes. That would fall into it, as long as the specialty of that physician is appropriate for what they're treating. You can't designate a chiropractor anymore. But I will say, years ago, a chiropractor would make a determination medically as a pre-designated physician on injuries that weren't under their preview. So that's where you have to keep that in mind.
Okay, thank you.
I just want to follow up on one thing. The last comment you made, Chief, was to protect the district. But if he's making decisions, his decisions aren't binding on our excess carrier that may or may not agree with that determination. That's correct?
That's correct.
All right, so that's something we need to also be careful about in terms of delegating to him. He may not, somebody else may not agree with him, and it may be a $10 million.
And it could be a risk, right?
And that's why we have Lawver in the room.
Yes.
And that's why also you want to be, there needs to be some consistency. Can't play, there can't be any emotional involvement in the decisions. It has to be very consistent, very factual, very objective, because that's when you can also run into problems, yeah. Team, is there anything I've said or haven't said that you guys want to?
Just driving home the medical evidence.
Yeah, yeah. Everything is medical evidence driven. And the timeline of that is what can be very frustrating because you're dealing with medical providers that are not always timely in the medical information that you need and getting seen and seeing these injured employees timely to get that information. And that's where it really gets frustrating. And for us too, we don't want to be the bad guy. That's not what we're about. So it's hard for all of us, It is. Do you guys have anything? No.
I would just think it's important to point out that we have never denied a cancer claim.
Yeah, ultimately, yeah. Yeah.
At the end, they've all been accepted, so just to be fair.
Okay. So here's the list of the presumptions. COVID-19 was a presumption for a period of time that did sunset. So that presumption is ended. It doesn't mean that someone can't claim that they have a work-related COVID injury, but it's no longer falls into the presumed compensable or presumed work-related. So in general, these are the presumptions that you can see here. As you guys know, you see probably a few of these more often than anything else that we see for the district.
Is there a chance you can reference this list like we typically see when a list is generated and we're not the author of that list? Can you reference this so when people see this, they can say, well, how did a hernia get in there? You can state California Code of Regulation and there be a reference, because as that continues to change, I think it's important that the public understand that, when they don't understand why, you get Lyme disease, it's presumption. And
right.
It's like, we're not the ones that are making this decision. It's the legislators who represent the community who then decide how this gets on there. So I just like to see when we have these things, if they're state law, that we reference that law so that people get an understanding that we're not picking and choosing these things at random, that we're following the law when it comes to these presumptions. Because, cancer, how many different ones are there? And
right.
We've got to be able to reference a document that the state mandates we follow.
Right, and they do it's cancer. They don't specifically specify which ones necessarily. So, and as we know, unfortunately, that's a growing, continual diagnosis, continual new things found. So, yes, each one of these has a history of how it ended up being part of the presumptions, and each one is part of case law and labor code that we can reference anytime needed. Yep.
I think that'd be important.
Okay, well, this looks like fun, doesn't it? So we go by Senate bills, Assembly bills, labor code, also case law that gets, pursued, goes through the Workers' Compensation Appeals Board, goes all the way up through the court system, and that is then used to quote for different decisions that we make. So this is Senate Bill 1127. Signed into law by Governor Newsom on September 29th, and it reduces the time period a claim administrator, employer, us on your behalf, has to deny liability of workers' comp. This is where we talked about the 75 days. I think you've heard this before be discussed in this forum. It sounds like a good idea on paper, but unfortunately, that time period being reduced when you already had a tough time hitting it in 90 days, and you have to send that letter out that we all already just talked about is awful. It can just be very difficult to receive because it's very difficult to make those decisions on the few cases you have to do that within that time frame. So that is talking about the reduced time periods, the temporary disability benefits under that that Senate bill, and then the penalties attached if decisions aren't made timely. Utilization review. So I know we've already talked quite a bit about utilization review. I think everyone understands it to a point. Anything that comes in for a request for authorization has to go through what's called a utilization review process. This was put into place many years ago. Before that, we could just say authorized, not authorized. It would go to a judge to decide if we were right or wrong. Who are we to say? We're not medical professionals. And so now it goes through a process. An adjuster can authorize, and our adjusters do, many things at their level. If they're not sure, it just doesn't seem right, this seems like not the right thing for this injury, it goes up to a nurse case manager. The nurse also can authorize. Only a peer review physician can modify a request or deny a request. So most of the time, all these things are being authorized. A lot of it is authorized at the adjuster level, but sometimes you get these unique, we've talked about some of the things that aren't proven to provide any relief that come through, that a peer review physician will talk to the physician, see if there's alternatives, and then determine if that's appropriate to be authorized or not. So that is what that process, it is in place. It's a good thing it's in place. I think it was important. The remedy for appealing that no longer goes to a judge. It goes to an independent party that is a medical provider. So that makes a lot more sense. We're keeping this in the medical community. But it does sometimes cause timeframes. So that's why it's so important. We're authorizing what we can at our level, which is very quick. We're doing pre-authorization at the clinic, which is very quick. But that which has to go up to a peer review physician can take longer. Generally, we have 5 days to do that, 5 business days from the time we receive the request for authorization. Again, gray area, there can be times that gets delayed because the provider didn't get back to you. There's certain criteria in then, but we're really doing everything we can. And Candace and Melissa, the chief, they've put a lot of things in place to ensure that we're really not having that reason be a reason that someone's treatment is delayed.
Excuse me, ma'am. I have
Yes.
a quick question just on that previous slide about 1127.
Want me to go
In
back?
the middle of the second paragraph, it says, this bill does not reduce the period to deny liability of claims for all injuries, rather only those covered in the listed sections. Is that the previous slide of presumptions?
The listed sections, it's cancer, it's not all presumptions. It's cancer, what else, guys? Help me out.
The heart trouble, pneumonia.
Heart, PTSD, cancer, and cardiac, isn't it? Is that it? Okay, yes, those are
Please repeat, I was distracted.
cardiac, cancer, and PTSD.
And lung.
It's in the second bullet.
I think, let's see, let me get my glasses.
No,
Hold on.
Where? I just see code numbers.
Yeah, I think we don't have it listed. I think it's just the code, right? Oh, pneumonia. Let me see.
Yeah, et cetera. So what I'm looking for is the list.
So the first bullet, last sentence, cancer, PTSD, heart trouble, pneumonia. I know it says et cetera, but I think those are the main criteria. I don't even, it probably shouldn't say et cetera. So I apologize for that because it really should be those 4 fall under there.
No, thank you. That was the clarification I was looking for.
Okay.
Thank you.
Shouldn't really say heart trouble either. Should say cardiac.
Cardiac, yeah.
I got a troubled heart.
Well,
Lonely Hearts Club.
it's not for heartbreak, let's just say.
Had a lot of that. Okay.
Okay, so any questions on UR before we move on to the next? We're getting close, guys. So permanent and stationary and maximum medical improvement. So every injury, as we talked about before, the goal is to get the person back to work, full duty, to the same status they were before they were injured. You know, even if they have a scar on their hand because of surgery that they had to have, they're really technically the same status they were before they're injured. That's the goal. It doesn't always happen. As we talked about, there's permanent disability and other things. But in workers' comp, so much of what we're doing is to get them back to that status where they call it permanent and stationary or maximum medical improvement, which basically means their condition is plateaued. They're technically maybe not going to get better and not going to get worse. Now, we all know sometimes 10 years from now, you may get better and you may get worse. But in terms of the treatment, in terms of what's going on with that case, they've plateaued at that point. There isn't any current innovative things that are going to get them anywhere else, up or down. They've plateaued. And so that's where we're trying to get for workers' comp as well. Are they back to full duty? Do they need any permanent restrictions? Can the district accommodate permanent restrictions? Do they need a voucher? Do they need to go down another road? Are we looking at settlement? What kind of level of permanent disability do they have? All of those things are happening once they get to this point. It doesn't mean that they don't still need medical treatment. They may need medical treatment for their injuries for life. When you settle your case by way of what we call stipulation, you are entitled to medical treatment for those injuries for life. So keep that in mind too, and I will quiz you on that next time, because I like to get that one out there. You know, when I was first in workers' comp as a claims adjuster, my supervisor back in 1992 told me that it's only good for 5 years. You only get future medical treatment for 5 years. So about 6 months later, I found out that it's for life, and I thought, she's teaching me, we got problems here. So it's really important to know that is for life as long as it's related to those injuries.
So I've got a question for a friend.
For a friend that maybe has a back injury from the past.
So you've got future medical for life, and now my friend has retired, needs another back surgery, gets the back surgery. A year later, she now needs another back surgery. Puts in the request, it is denied. Goes to, the doc puts in RFA, gets denied. Goes to peer review, gets a second opinion from another doctor, denied. Appealed, denied. Goes to an IMR, denied. What now is the course?
My gosh. Okay, I'm trying to follow that whole path. But
The end subject is
it's not authorized,
It's gone to an IMR at this point.
Okay.
Okay.
So the IMR is going to make a determination whether to override the decision or not. So if IMR upholds the decision and says, no, this is not authorized, it's not appropriate, the only recourse is then to go to the appeals board. And there can be, you can request for a hearing. If there's an attorney involved, there's certain recourses you can take. But if it's gone through all of that, I would just say that as much as we all sometimes think surgery is the answer, if that many medical professionals have indicated it's not authorized, then I think we really need to talk about what's going on. Why isn't it authorized? Is this a technicality? Probably not with that many steps. Or is it just really not going to have the right outcome and they feel it's very dangerous to do that again? Those that have hardware in their back, you can only do certain things so many times in the same area, whether it's a fusion or whatnot. I'm certainly not a medical professional, but I think those are the kind of conversations we would need to have. And there are recourses still. There's always going to the court system.
Well, that's my question is what after that point? Say that the individual then went through private insurance, had the surgery, and recovered tremendously.
Right.
What now is the recourse for this person?
So if they ended up going through private insurance, which a lot of the folks that are retired with the district have future medical with the district for life, So let's say they do that and it turns out to be really successful. You can certainly make a case to have it be reimbursed on the work comp side. But generally, your regular health insurance is not going to go through the path of doing that. We also, not to get too crazy in the weeds, but we have Medicare to take into consideration. Medicare is very interested in things that should be covered by workers' comp that are being paid by the health insurance industry and paid ultimately by Medicare in many cases. And so there's also that to consider as another component. But I think the biggest thing is we need to talk about it. You know, I certainly don't know if that's a claim that we're handling, but we need to be talking about it and talk about why, maybe get our medical director involved, like what's going on? You know, is this just really that dangerous? Like what, are there other options? You've already got a second opinion, you've already got the IMR, all these other things. So yes, there's always recourses and it can go through the court system, but more importantly, we're all human. Let's talk about it and make sure we're making the right decisions. It's gonna be the best for the person and their recovery.
Thank you. I'll let her know.
Thank you.
Alleged friend.
Okay, so med legal evaluations, I've alluded to this numerous times, and med legal is where it's a qualified medical evaluator. It can be an agreed medical evaluator, which is the third bullet. Agreed medical evaluator, if someone is represented and we are represented, we can all agree on who the medical evaluator is. Most of the time you're going through the state to request a panel of physicians that are then chosen from for the injured employee to see to have that medical evaluation. And that comes into play after someone is permanent and stationary, so sort of at the end, they've plateaued, or it comes into play on those delayed cases where we're trying to make that decision and they're getting the specialist and the med legal evaluation. The state has a list that you have to use for med legals. Again, they provide a list of 3. We can strike one off, the injured employee can strike one off, and then the one that is left is the physician that they're seeing. So it is a bit of a, I don't want to say crapshoot, but you know, you don't know sometimes the physicians that are on there, and you don't know their success rate of, you know, what they're treating and whatnot. So really you're just getting physicians that the state has vetted and that are on their panel, and that is who is evaluating the injured employees at that point and making those determinations. Settlement. So at the very end, are you guys tired yet? I'm sorry. At the very end, they've plateaued, right? They're plateaued. They're about as good as they're going to be. And we need to look at, do they have permanent disability? Do they have the need for future medical treatment? And how are we going to settle their case? We can settle their case by stipulation with request for award. And if we do that, how long do they get to have future medical treatment for their injury that's work-related? Do you remember? I'll ask you next month too. So yes, they can have it for life. So sometimes you may have where they don't have any permanent disability. It might be 0. It doesn't happen very often, but they might have none, but they need future medical treatment. They need whatever that is over time. So we settle a case that way, and then they can get that future medical treatment. The other way is by compromise and release. And this is just there are other ways that go through the court system, but these are the 2 basic ways. Compromise and release, they get more of a lump sum that's buying out that future medical treatment. So they're getting a lump sum of money rather than us paying for the future medical over time. They're getting money for any permanent disability, and they're getting a lump sum for that future medical. And each one of these are case by case. Are they still working for the district? You know, how much of that future medical do we anticipate they're going to utilize? All those things come into play when we look at how to settle their claim. Any questions on that?
And it can't be reopened. CNR, you're done.
CNR, compromise and release, you're done. That's it. Oh gosh, I hate to tell you this. There is a little bit of a gray area, but we don't need to go down that road. Yes, they do have, there is statute where they can come back for a period of time and we can come back, and there's things that can happen, but it's very rare. So generally speaking, think of compromise and release, it's closed, the future liability of that claim is off your books, done, case is done. That's generally the way to look at it. And then a stipulation can be open for a very long time. The state allows us to close those cases actually if they don't treat for 2 years. So they call it administratively closing it. They can always come back, but we just don't have to keep it in an open status when they may never come back. So after 2 years, the state allows us to close those cases. So I know this was a lot of information. We could honestly talk about this for days, and I certainly don't want to be the one to talk about it for days. We would get my group here involved, but we wanted to be able to give you guys enough information to have those important, hard conversations even, to talk about some of the challenges and some of the things that happen with workers' comp. We can dive deeper at another time, as these guys said, version 2. We can do as much training as you need to do. I don't want you to think that we're trying to force you into learning just certain things. That's certainly not the case. And really want to make sure that we're doing what you need to help you make the important decisions that you need to make. So thank you for your time today. I appreciate it. Thank you. Thank you.
Okay, folks. Well, hopefully my colleagues, I know I did, my colleagues, we got a lot out of that educational seminar tonight. And thank you for the team for being here. Before we move on to any other items on our agenda this evening, I want to open it up to my colleagues. Any comments relative to this particular event?
Just a thank you.
Yes,
Okay.
thank you.
Very informative, very informative.
Thank you very much.
Yes, sir. Sir,
Chief, oh, Bob, go ahead, sorry.
I've said it from day one. Thank you, Intercare. You're doing a fantastic job. My friend said it has nothing to do with your TPA, but honest to God, you guys are doing fantastic work, and we thank you very, very much.
Thanks, you guys. Awesome team. Thank you very much.
It also makes us aware of what a good job our department is doing, by the way. Yeah. Yeah, absolutely. Thank you.
So I think this has been successful. Thank you to my colleagues, and again, to all of you that have been involved in putting this together. Just like any good college course, Workers' Comp 101 needs to be followed up. We'll figure out when that makes sense to this group. We continue to get a lot of things put on our plate, but I think this is really what we envisioned at the beginning of the year, is starting to educate not only the folks at this table that do a lot of workers' comp claim work, but also the men and women out there. And so we know that that's part of the ad hoc committee's goal, is to see our men and women become more and more aware of what this benefit really represents for them, so that we can take on, have an environment that they know will take care of them in times of injury. I think that's a really solid outcome. So thanks again for your work tonight. With that, we're actually, I just wanted to let my colleagues know that we will not be having a closed session tonight. I know that comes with deep pain and angst, but there won't be a closed session this evening. So with that, I will invite, as I commonly do when we go to closed session, I'll invite all of you. It will not offend us if you decide to get up and go see your families now. So don't feel obligated to sit through a bunch of reports that you probably could care less about. So if you'd like, I can even take a few minutes and let you leave out of here without a lot of us staring at you, or I think Arthur's got the cameras focused on you right now. But why don't we do this? Let's take a 5-minute biological break, and we'll reconvene here at 8 o'clock.
I'm going to defer.
Arthur, you ready? All right, ladies and
Recording
gentlemen,
in
we're going to get
progress.
going again.
Salute.
Was excellent. We appreciate all your attention. We're just going to quickly move through reports this evening. And by quickly, I mean President Gould has no report. Thank you very much. Chief.
And I have a very short report. I just do want to mention a couple things and acknowledgements. First off, fire camp has been very successful this week. It's going on. The last day is tomorrow. 80 kids having a ball.
8-0?
8-0, I believe.
Good.
Fully out with a waiting list, and very successful. We've got retirees as counselors to on-duty personnel to
Yeah.
our first ever single role as a counselor out there.
Oh,
So, great program. I'm going to start off, and since I see Chief Law out there, I want to let her explain what happened. But under her leadership, I cannot thank her enough for exceptional leadership for her entire division of CRRD and the investigators for these two successes, one of which is the largest and greatest one documented in Sacramento County. So I'm going to turn this over to Chief Law, because I think, as she explained it to me on the phone, she'll show her excitement. So, Chief Law, thank you very much, and great leadership in your division.
Chief, I appreciate the comments. So the first update I wanted to give you is on fireworks. As you know, we're approaching the 4th of July. It's already been picking up since the beginning of May in regards to our citizen complaints and tips coming in about illegal fireworks use in the community. We did receive one that had actionable information with a good address about online sales with an ad that was posted on Instagram. So we were able to go out and validate that complaint and work with the sheriff's office to seek a search warrant after validating the information was accurate. And that was executed safely and successfully. And we seized about 8,000 pounds of illegal fireworks in a 3-car garage in a residential neighborhood, as well as about $30,000 in cash, I believe, a number of illegal firearms. Arrests were made. So pretty proud of that, and very appreciative for the anonymous tipster that sent that in. People do need to know that them sending in the information does help us. You may not see an immediate impact. It takes time to work these cases and put something together. But big success and big win, largest seizure in Sacramento County history. So yay, pretty pumped about that.
Yeah.
Other thing we had, as you know, it's been getting busier with these fires. We still are challenged with our staffing levels in the fire investigation unit. So we did have a day where we did not have any investigator twos available to cover, and we had one of our fire inspectors step in, and he was able to work some leads in a case all day long that led to an arrest on a serial arson case. So we had about 7 fires in a 24-hour period, and Benton Christensen was able to put that together. This individual will have a preliminary hearing on July 8th on new charges. So, and then Krista Aney had her first criminal arrest this week. So kudos to her. I know she's been waiting. She's been working for about a year, but we finally got one for her. So it's going well. It's been very busy, but keeping the community safe. So thanks, Chief.
Great, thank you. And I'd just like to end with this, as you hear me talk about collaboration a lot, not only with 522, but our external stakeholders. What Chief Law didn't mention that she gave me intel on is that with this 8,000 pounds, I have to mention a great team effort with obviously Chief Law, but the Sheriff's Department locally. But this also included, because of the size load, our logistics team coming out, and also Engine 50 assisting with loading all those boxes. So it was a huge success. So collaborative effort. Once again, thank you for thinking outside the box. That was great. And since this is our last board meeting before the 4th of July, I have to remind everybody, since you didn't, safe and sane fireworks. I'm surprised you didn't. I wrote it down and I go, she didn't mention it once. Wow. So safe and sane approved fireworks. Please take care over the 4th of July to all of our citizens that are out there. And it is also a busy time for the river. We've already had one fatality on the river, which was a younger citizen of our community. So remember, if you're going to go out to the river, watch your drinking and wear a life jacket. So be safe on the river, be safe on 4th of July. This is our last meeting before that, so I would not do due diligence as the fire chief for our great county that we serve all up and down Metro's jurisdiction for not just a reminder. So thank you. That's the end of my report unless you have questions. And a great evening tonight. I think we all learned a lot. So,
thank you, Chief. Chief Law, can you just let us know how many approved fire sales locations that we've got in our area? You have any idea?
We're doing the booth inspections tomorrow, and I think we had about 155 applications come in, but you know, in the last week that can flex a little bit. So we'll know tomorrow when everything's done how many are out there.
Yeah, and I just think it's important that the public know that the way we can continue to sell safe and sane fireworks is by everyone taking on the responsibility of using those legally useful fireworks in a safe and sane manner so that we don't have to get, tighter in restrictions. So I appreciate that. Thank you. Thank you, Chief. Appreciate that. Moving on, we don't have any reports from any of the fire chief's staff tonight, and that was intentional, not that they don't want to, but we asked that not to happen. I see that our local has left for the representative from the local has left for this
Correct,
evening.
and he mentioned to me no report.
Okay, excellent. So we'll move to committee and delegate reports. I have no report from the executive committee. We'll move on to Comm Center, no report. Finance and Audit Committee, Director Jones.
Thank you, Mr. President. All right, we've received a presentation tonight, bi-monthly fiscal report through April 30th. We are still waiting for in arrears for our PPGEMT of 8.1 million to be made up. However, good news is that the average return for our SERB investment is 6.4%, average. So that's pretty good. Next meeting, July 25th in these chambers.
Thank you, ma'am. Moving on to Policy Committee, Director Costa.
All right, nothing, no new updates. Our next meeting is July 11th.
Okay, we'll start with you on board questions and comments.
Just want to say, everyone have a happy and safe 4th of July, and to the men and women of this organization, I'll be out and busy. Be safe. Thank you.
Director Jones.
Thank you. I do have to give a shout out, so give me 60 seconds, please. Compliments of Chief Adam Mitchell. I was able to do a visit and attend on different calls out of Station 61. Because my goal was to understand and to get a feel for how the squad is working there. It's terrific. It is absolutely terrific. It's a way to effectively deploy our staff members where they're needed, our firefighters and paramedics. It was just great. I'd encourage everyone excuse me, to go ahead and do some kind of visit like that if you don't have a feel for it. It's a new aspect of the fire service that wasn't around when I was working. It's great. That's all I can say. And a big shout out, Engine 61, Captain Joel Greenfield, Engineer Rich Walker, Firefighter Cole Schaefer, Squad 61, Firefighter Benjamin Hicks, Firefighter Kevin Lohype, Medic 61, Firefighter Trevor Morris, Firefighter Wesley Foster, probationary firefighter Logan Funker. And I got to visit with our Medic 661B, Metro Medic 661B with EMT Joel Gomez and EMT Megan Miller. A very good success, and thank you so much, Chief Mitchell, for arranging that.
Thank you. Director Sailors.
Meetings tonight, thank you.
Thank you. Director Weber.
I have no comments, thank you.
Thank you. Director Clark.
Yes. Yes, this was a great night. I've learned a lot about workers' comp, and it's good that we're continuing the tradition that we've established with Chief House of seeing the faces of the people that serve us, and it was really good to see the intercare people and how they work, and you know, it's very good. The other thing is I wanted to thank Sean Scholar for a tour of the fleet division and comm and seeing the work that the mechanics are doing and get a chance to talk to them. And what an excellent crew. Those guys I call it a Cracker Jack crew over there, and they're really doing a good job. So it was, I invite the rest of you to take a chance and go over there and see how, you know, how they're working on our ambulances and the engines and whatnot. What a great group of guys, and they're really tight. They support each other, and they're very dedicated. That's all I have, except for safe and sane, and everybody be safe out there, and please don't start any fires. We got enough things going on.
It's always good when the director says, just don't start fires.
Yeah, please don't.
It's okay to have a heart attack. Just don't start fires. Director Wood.
Thank you, Mr. Chair. Two things, just real quickly. I want to echo what the chief said about fire camp. Nothing but great things I've heard coming out of there. And just a reminder that everyone that's out there, all of our crew and the counselors that are out there are all volunteering their time to help these kids in our community. So it's just a wonderful thing to hear, and I'm excited to be out there tomorrow serving lunch with them. So look forward to seeing that. And lastly, Saturday night is the luau on the links. Director Weber is going to be volunteering with us. Look forward to that. and understand a few others will be there. So look forward to seeing everybody. ffburn.org is where you can get your tickets in advance. Thank you.
Thank you, Director Wood. Okay, as we close this evening, just really quickly, as we celebrate our independence in a couple of days, I'd just like to ask all of us to remember the sacrifice that men and women have made throughout the decades that allows us to continue to celebrate our independence, particularly those men and women who have made the ultimate sacrifice as veterans of our various military groups. The chief and I have some affinity and some deep feelings for those groups, and we are working on a program that hopefully in the near future we'll be able to share with the entire body of Metro Fire. But what a great thing that we get to celebrate our independence. We get to have boards like this without any significant oversight from our government. And I just want to say thank you to the men and women who will be not only serving on our shifts, but also serving in our military this time of year as they're away from their families in many cases. May they be watched over and God bless. Thank you very much and have a wonderful weekend.
All right.